I'm here.
Clegg,
Here.
Halliburton,
Here.
Sanchez,
Here.
Thompson,
Here.
Woodings,
Here.
all present.
Great, thank you. Next up on the agenda, do we have any, there's nothing to change, no motions for amendments? Okay,
Not this time.
great. Item number 2, a request for the approval of the minutes from April 14th.
Madam Mayor, I move approval of the minutes of the regular city council meeting of April 14th.
Second.
The motion is second. Clerk, will you please call the roll?
Woodings,
Yes.
Bajent,
Yes.
Clegg,
Yes.
Halliburton,
Yes.
Sanchez,
Yes.
Thompson,
Yes.
all in favor, motion carries.
Thank you. So next up, under special business, first we have the appointment of TJ Thompson to the Harris Ranch CID Board beginning April 2020, that's now, and ending March 2022.
Can I vote no on this? I'm just kidding.
Don't mess it up, we're gonna do unanimous consent.
Madam Mayor, I ask unanimous consent unless there's an objection to appoint TJ Thompson to the Harris Ranch CID Board for a 2-year term ending March 2022.
Without objection. I'm muting.
Thank you, TJ.
Thank
Thanks,
you.
TJ.
Madam Mayor,
Yes,
I would just like to welcome Councilmember Thompson to the Harris Ranch CID Board. We have great fun.
Can I say a few words? No, I'm just kidding.
do you Zoom right now? Are you meeting right now? Have you had to?
We
Oh.
haven't met yet.
Not yet, not yet. But that's why we needed him appointed.
Thanks, Councilman Thompson.
Thank you.
All right, and next up, we have our weekly emergency preparedness approach update for COVID-19. And with us, we have Mallory Wilson, and it looks like Wendy Elstead is joining us too for this evening.
That's correct. Good evening, Madam Mayor, members of the council. Madam Mayor, do you have any comments this week ahead of my presentation, or should I just jump right in?
Or just put in that, go ahead and jump right in.
Take that as a no.
No, I'll say something. Sorry. Thanks. I wasn't thinking when I put that all in my mouth. In the last week, and I just want everybody to know that after that initial presentation of some of the things that communities ought to look for and states need to look for in terms of how and when to time getting back to work, we are now, as a city, while maintaining preparedness and ensuring that our folks are delivering essential services and ready to be deployed if something comes up. And we're also beginning to look at how we as a city government bring our people back into the building. And just as we tried to set the stage by shutting down and developing the policies that others could look to, we'll be looking to do the same thing internally to bring people back into the building. They've all been working. And then recognize that it's a phased approach, because as we ensure that we're not seeing adverse impacts, and then you might be able to do more. And that we as a city government will be doing just the same as what we'll be asking the public and private employers to do as we move forward. So more on that in the coming, I believe next week, but Mallory might be pointing to just a tiny bit of it today, but beginning tomorrow, city staff, leadership of the departments, and we'll be looking at what phases look like and preparing to come back to you and the community with a plan in the following week.
Great, let me. I feel like I'm getting quite good at these Zoom meetings. So after last week, here's a couple of agenda topics we'll be hitting on. Go through the first couple real quick. So the main star of tonight's presentation is that approach that Mayor McLean referenced, kind of how we're looking as a city in the near, mid, and long term as far as unwinding some of the orders, specifically, beyond any of the governor's orders. But first, we'll take a look at the normal kind of counts and trends over the week, a couple of hot topics. follow up with any outstanding items or questions you guys have from Wendy's report and our work streams that we've developed. And then I'll look at our federal funding. So looking at the cases, so another increase in cases across the country and within the state. In the US, we're up to about 750,000 cases in the US, so trending pretty high. Just a couple minutes ago, and I pulled the cases from the state's website. We have 1,766 cases within the state. And a little bit of change in reporting here from last week and previous weeks is that the state and the counties are now including both confirmed and probable cases. So confirmed would be those cases that are test confirmed positive, and the probable ones are folks that have had contact with someone who has tested positive and are exhibiting symptoms. And there's a couple of other criteria, but it's a pretty strong suspicion that it is a positive COVID case, excuse me. So that's what those numbers are. So a couple of the numbers over the past week, the totals are a little higher just because they are now including those probable cases, which they weren't necessarily in the past weeks. So with that, 51 deaths, 622 cases, again, oh, and a typo there, again, confirmed and probable within Ada County, and 12 deaths. And so that part of that, including the confirmed plus the probable, that today's graph is a little bit different, you'll notice, because this does include those probable, but I didn't want to make it the visual too messy, so that we can still see kind of that consistently flattening curve, still increasing a little bit, but generally working towards the flattening. With new case trends, I included another graphic today as well. So the one in the bottom left here is our new case trends that are as reported, but the state has now also included on their dashboard cases by date of onset, which gives us an additional look at kind of how we are looking, because these new case trends, as I think I've mentioned before, this is just when the positive is reported. It isn't necessarily dependent on when folks started having symptoms or when they got tested or any of those factors. This is just when they were reported. So this is in the upper right here is a view looking into cases by that date of illness onset as reported by the patients. But still the curves mirror pretty good, and we are still seeing that significant downtrend trend. A couple of hot topics to just touch on from the week. The Resource Center calls and email volume remains pretty steady over the past week as it has the past couple of weeks. A couple of items that have come up consistently in that regard would be requests for compost and glass recycling to be reopened, and then additional questions on the governor's amended order as far as reopening businesses. We did have a good success this week, that isolation bed plan and plan for those experiencing homelessness that Christine Miller's group has been working on for quite a while now. We're able to get that stood up just in time to have the first COVID positive guest at the Cottonwood Hotel. So that current plan is working as planned. And so that was good to see that plan able to come to fruition, even though it did mean we had that one positive case. And then kind of referencing back to that Resource Center highlight of compost and glass requests to be reopened. A little update there is that, so glass drop-off is closed, but because the public continues to use it, Republic Services has continued to continue that program and continues to pick up glass at those sites. And then there is also a significant amount of traffic still at the household hazardous waste drop-off sites. There are staff present there to ensure that nothing gets left that's hazardous, and to provide some guidance to say that the county landfill is still accepting those drop-offs, even if our city household hazardous waste drop-off sites aren't open. And then just a little update on some of the healthy distancing data that Kyle has been gathering, and that's posted to that city website under the data and dashboards area. We are starting to see a little bit of an uptick in some of the downtown parking and an increase in just general distance traveled by individuals. And then more specifically, or more, more evidence of I think the weather and maybe some of the effects of COVID on the community is that the trail and greenbelt use has gone up almost exponentially, quite a bit of increased use on those in those areas. So just a reminder for folks that we are still in this, still responding to COVID, even though we are seeing that downtrend in cases, that it's still important that we follow the stay-at-home order and maintain that social distancing when we're out and about getting fresh air and able to recreate still. So with that, unless there's any questions, I'm gonna stop sharing for a minute and toss it to Wendy for any questions on the weekly report or the work stream updates from Friday.
Thanks, Madam Mayor, Council President. As you noticed, this past Friday, we sent out an executive report that is a summary of all the activity across all the city with regards to response planning for COVID-19. Are there any questions that I can respond to?
Madam Mayor? Madam Mayor?
Sorry, I was muted. Councilmember Sanchez.
Yeah, thank you. Yeah, I had some questions about the hazardous drop-off sites. I've been really thinking about that, and people have just, trying to find ways to manage their time at home, and I've been really concerned about maybe folks working in their garage and coming across hazardous items and not waiting, not holding on to those items until we get those mobile units going again, and possibly throwing those in the garbage where they don't belong. What is the possibility of us getting those hazardous collection sites going again?
And I know Haley Falconer, sorry, Madam Mayor, Councilmember Sanchez is on with Public Works, and I think she can probably speak to that or answer some questions along with Steve Burgos.
Madam Mayor, Councilmember, great question, and thank you for having me here virtually tonight. Certainly, that is something that can be done. There is a location right now. There's a permanent facility at the landfill. They've got a building and their staff, their contracted staff that the landfill has through Stericycle that are still operating on Fridays and Saturdays with their same hours. So that's where we've been directing people while we're still within the governor's stay-at-home order. Certainly prepared to go back to the mobile sites, but if there was a different direction that we wanted to head, we could certainly ramp up the mobile sites in that intervening days and get those back. We did note that the county still was had some sponsored messages about the dates on some of their social media, so we did ask that they remove those. I think that may have been tied to some of the increased traffic at a couple of the more popular locations. So with that being pulled down, we don't anticipate that same traffic in the next couple of weeks. But certainly look to you all if we want to get those spun back up, we can do that. But we're looking for those kind of non-essential places where we could keep people separated.
Thank you so much. If anything, could we do some extra social media on directing folks to where they can take those items? I'm just really concerned that people are getting antsy and they're cleaning and they're not going to be holding on to those things until we get those mobile sites opened.
Yep. Madam Mayor, Councilmember, certainly. Oh, sorry, Steve, go ahead.
That's right. I just wanted to add one quick comment, Madam Mayor, Councilmember. We actually specifically asked for public services. Are they seeing any indication of hazardous waste being thrown out in trash? And they haven't reported anything to date. So just to answer your question directly, we haven't seen any indication of that. But we can certainly up the game on social media to let folks know to take their household hazardous waste to the landfill.
Thank you.
Okay, thanks.
Any other questions for Wendy or the weekly report? Okay, Hearing none, I will share my screen again and then toss it over to Linda to talk about a federal funding update.
Great. Thanks so much, Mallory. Good evening, Madam Mayor and Mayor, Council members. I just want to give you a quick update on the status of the federal funds. The city itself is going to receive several sources. So far, we've received about $840,000 from HUD for CDBG, and I believe you received a memo last Friday from HCD on how they plan to disperse those funds to local nonprofits on a tiered system based on compliance risk. The airport is also set to receive $18.9 million from the Department of Transportation. They intend to use these proceeds to cover personnel, operating expenses, and debt service payments. They said that this should get them through the end of the fiscal year and maybe longer. The only string attached to those funds for them is that they need to retain 90% of their current workforce through the end of the calendar year. We have some partner agencies that have also received funding. VRT through the Federal Transportation Administration is going to receive $20 million in funding. We are currently working with them to collaborate on a framework to guide the use of those funds. And then Our Path Home is applied for Emergency Solutions Grant, $4 billion, which was made available through the CARES Act through HUD for homeless prevention services. The state has received their funding for the coronavirus relief funds, and they are waiting for Treasury guidance to disperse those based on eligibility, getting more guidance from Treasury on eligibility. It's likely that the delay there is because of the legislation that's currently in Congress that was going to allow additional flexibilities for local governments to cover items such as revenue loss from existing CRF funds. But unfortunately, the latest bill that is in the legislature is not going to include those items. That bill was passed in the Senate actually this afternoon, is expected to pass in the House later this week for $484 billion total, mostly to supplement the small business relief, the Paycheck Protection Program, supplement needs for healthcare systems, and a national testing strategy. Even though we did not secure any additional funding for state and local governments through that, the Democrats did secure a commitment from the White House and from Secretary Mnuchin that the next round of COVID relief package would include additional funding for state and local governments. That's the end of my update. If there's any questions, I'd be happy to answer them.
Madam Mayor.
Go ahead, Council President.
Thank you. I know that, as Linda mentioned, VRT got a fair amount of funding, and would like to understand what kind of conversations we're having with them. Maybe this would be a place where council members who are on the VRT board could participate with staff as we're having those discussions.
Madam Mayor, Council President Clegg, we're working to schedule a meeting in the coming days with them, and I would certainly welcome if city VRT board members want to join that. I think that would be helpful. I think there maybe is a little bit of a disagreement between city staff and VRT staff of the best use of those funds. So, we're happy offline to maybe elaborate of what we think city staff feels like would be the use of those federal funds.
Yeah, that'd be good to have a city discussion internally. Thank you.
Yep.
Madam Mayor, I have one question.
Sure, I didn't see who that is. Is it Councilman Thompson?
Yeah.
Sorry, I can't see all of you at once right now.
Yeah, my question, if for whoever can answer, does anyone know when the state of Idaho will be able to start providing those that are unemployed the additional $600 check each week?
I don't have specific guidance on that. I've heard that it's a technical issue with their system, their disbursement system, the software that they use to disperse those funds, and that they're working rigorously to try to update that software to be able to disperse the extra $600 per. But I don't have an insight onto the timeline there, unfortunately.
Thank you.
Madam Mayor,
Council President.
thank you. Councilmember Thompson, I was on a phone call with the governor of city's phone call last week that Mayor McLean could not make. And the governor's staff did say that they were working to correct that, that issue. The fact that Idaho has not had a disaster in the last decade means that our software was never updated for that disaster relief. Much like, say, a place where there's hurricanes or tornadoes regularly. So we should be happy that we don't have those, but apparently that's the issue, and it is quite a cumbersome process to update the software. The estimate they gave on the telephone call was mid-May before that would be done.
Thank you. I appreciate that.
All right. Without any further questions on funding, we will move on to the looking at how to reopen the city, and that'll be Kyle talking us through that.
Good evening, Madam Mayor and council members. I think Mallory said I was the star of the show tonight, and I feel pretty good about that, so I'll try to do my best. This slide you'll probably recognize. The last couple of weeks we've talked about the expert guidance on how and when to reopen after COVID. So really what they're saying is, we shouldn't restart reopening again until there are few or no new cases, and we have the hospital and public health capacity available to respond effectively if a new outbreak happened to occur. And they also say that when it's time, we should be very slow and thoughtful about how we lift restrictions. So lift a few restrictions at a time, wait a few weeks and see what happens. If we don't see a new outbreak, then maybe we can lift more restrictions. Next slide, please. So the White House last week released some guidance providing a framework for reopening. And it actually closely aligns with the kind of principles we've been talking about at these meetings of being slow and thoughtful in reopening. And it recommends a 3-phased approach. So in phase 1, we'd lift some restrictions and then we'd wait and see. Again, if another outbreak were to happen, maybe we'd move back to phase 0. If nothing's happening, maybe we advance to phase 2. I want to stress that this is a phased plan. It's not a timeline. It doesn't say that phase 1 is May, phase 2 is June, et cetera, et cetera. It's really about being adaptive to the situation on the ground. So if we're not seeing any new outbreaks happening, we can keep advancing through the phases. But if a new outbreak occurs, then we'd have to move backwards. Next slide. As the mayor alluded to earlier, I've been starting to work with the mayor's office, and we'll work with department heads throughout this week to start developing a couple of reopening frameworks based on that federal guidance. So one would be more external looking. How do we reopen businesses and lift some of those social distancing restrictions? And another one would be much more internal about city services. How do we reopen city services, and how and when do we bring staff back to City Hall and other locations? But there's a few principles or goals that we're trying to think through in developing those frameworks. One is we want it to be based on up-to-date data and readiness. So we should be able to see on a daily basis on the ground what's happening and know what's going on. That we want to mitigate the risk of another outbreak happening as much as possible. Through all of it, we want to protect the most vulnerable from contracting the illness. And then we want to be transparent and communicative. It's a time of a lot of anxiety and uncertainty, and we feel like by providing a framework that we can share publicly with folks and sharing how we're going to make the decisions about advancing from one phase to the next, we can mitigate some of that to a certain extent. And then lastly, we want the city to lead by example. We feel like we should go above and beyond whatever we're requiring of private businesses. Next slide, please. Thank you, Mallory. And then the next steps are that throughout the next week or so, I'm going to continue to develop that community reopening framework in concert with city staff. And then I'm sure that we can email out a draft of that to you all council members later this week. And I can present on that next week at council. and then also coordinating closely with departments on a reopening framework for city services as well. And the goal for that is by the end of the day next Wednesday, so a week from this Wednesday, to have a plan in place for that. That completes my presentation. I'd be happy to answer any questions.
Madam Mayor.
Go ahead, Council President.
Thank you. Kyle, question about I guess the third piece of that group of 3 things that we need to have in place to reopen, and that's the strength of the public health system.
Yeah.
I'm guessing from what I'm reading, and maybe you can tell us more, that while we're getting more testing, we're still short on tests. We had a fair discussion last week about the ability of our public health system to do contact tracing, and I know they're working hard to increase that ability. Do we know any more about either of those 2 things?
Madam Mayor, Council President, that's a really great question. I think that I agree with you from everything that I've read and heard that, you know, we've made some advancements on the testing front, but we're still nowhere near where we would like to be. You know, I think there was a study that came out from Harvard last week that said something like we need something more like 2 million tests a day more than we are doing currently to really. So I don't have a strong expectation or belief that anytime soon we'll get to that place where we have the testing where we want it to be. The kind of next step for that is maybe we can't test as many people as we'd like, but at least we should be able to test healthcare workers and folks who are symptomatic, and we might be moving closer on that piece. On the contact tracing side, I know that Mallory has been working with Central District Health on working with them to develop a kind of a surge plan so that they're confident that if another outbreak were to occur, that they would have enough capacity to do that. And I know that we've talked internally about the potential to redeploy city staff for that purpose. There's a number of barriers to that happening, but it's still on the table. And so I'll let Mallory speak if there's anything I left out there.
Madam Mayor, Council President Clegg. Yeah, so we, the health district is working to, you know, without speaking too much on their behalf, the health district is working to continue to increase their tracing capacity, and that exploration of potentially using other employees outside of their normal staff to assist with that. So we've got a little bit of movement on that, but need to have some more internal discussions before it's really ready to present in a more full manner. But there are some more conversations moving ahead in that regard.
Thank you.
And Madam Mayor, Council President, one thing I'd add is there is a group of cross-agency folks working right now with Central District Health on trying to get access to some better data for our decision makers on this front. And we've had some good progress on that to try and get some more data on testing that's happening on things like cases by race or ethnicity. So we have a window into those pieces, potentially some metrics around contact tracing and the capacity there. So I'm hopeful in the coming weeks, we'll get access to better data so that we can know where we stand in those regards and make decisions smartly.
Madam Mayor.
Yeah, go ahead. Just gonna be
Thank you. Kyle, along those same lines, is the data, has it been requested, I guess, for the data to also be drilled down to census tract data so that we can kind of track the illness within our own?
Madam Mayor, Councilmember Wooding, that's a really great question. That has definitely been one of our asks. I think that Central District Health is a little bit reticent about providing data at too fine a granularity because they're concerned about the privacy of their clients, understandably. And so we're having conversations with them now about ways that they can provide that information to us that won't be compromising the privacy of clients. I know there's a number of states and counties throughout the country who are making that kind of case data at zip code level available to the public. So we know that there's not a legal restriction to it. It's just about doing it the right way. And so I'm confident, I think we're making progress in our conversations that we'll be able to find a way to do that.
Great, thank you so much.
Madam Mayor, if I could have one follow-up, Kyle, on the testing front, are we in a position to be able to get data from the Crush the Curve effort in terms of antibody data?
Madam Mayor, Council President, that's a great question. I haven't been in contact with them recently, but I know when they started to kind of line up their work, they were open to that data sharing piece. So that's something I can follow up with them on.
And Madam Mayor and Council President Clegg, I believe in a call, they were expecting to have the initial results of some of their antibody testing tomorrow, if I'm remembering correctly. So maybe we will see some of that come out. But yeah, we can reach out and get that, open those communications for potential sharing.
Great, thank you.
And I would add to that I think the antibody testing is really important, in part to really understand the full extent of the virus, where it spread and we don't know it. I am hesitant to use it as a way to understand if folks have developed immunity. From what I've read from the experts, there's not a lot of evidence yet that folks who have had coronavirus develop immunity to it yet. So there's some danger to using it on that front quite yet.
Madam Mayor.
Go ahead.
Kyle, I really appreciate your continued work with all this and these updates. You said a little bit earlier that it's hard to designate a certain time frame or a date to any of the phases. But do you have any idea sort of like what the timeline as far as the actual phases look like? So we know that potentially removing the stay-at-home order may be like step one. And then we also know that like having large groups allowed to gather of certain sizes may be one of the final steps. Do we have sort of an idea of what the steps are going to look like in between?
We're Council Member Halliburton, thank you for that question. We're in process right now of figuring that out, of kind of fleshing that out. I'd be happy to share, it's publicly available as well, the White House guidelines, which are pretty broad and vague and high level, but do a good job of laying out how that might look, right? So like phase one might be that we're only bringing a few staff back into City Hall for really important services that must be provided in person, right? But still have only small group size and have a lot of protections in place. So, I think next week I can provide a lot more information on that front.
Thank you. Thanks, Kyle.
Great.
Madam Mayor?
Yep.
Kyle, thank you so much for that information. You know, I'm curious about that protest that we had at the State House on the 17th. Do you know if we are going to be tracking any of that, or if Central District Health is going to be making a note on the air about how that may be affecting any increase in COVID cases?
Madam Mayor, Councilmember Sanchez, I haven't heard any talk about that. You know, we definitely know that the amount of contact that folks with others has a direct relationship with the amount of folks who get become infected. So there is likely some impact there, but I don't think, just given the nature of those events being one time and not that many people, that we'll be able to kind of untangle that from a data perspective.
Thank you.
Right, well, thanks, Kyle, for putting all this together and for being our point on earlier when I talked, I didn't realize Kyle was on earlier when I talked about putting together the different phases of what returning to work would look like. Kyle is working with Wendy and of course Mallory on that. And so you'll continue to hear from him. And really appreciate all that you guys are doing in the last multiple weeks now, but since we saw you last week as well. Thank you.
And that is the end of the staff presentation, Mayor.
Great, thank you. So next up on our agenda, we have the consent agenda. Yeah.
Sorry, Madam Mayor, I was on mute. Madam Mayor, I move approval of the consent agenda as presented.
Second.
We have a motion and a second. Clerk, will you please call the roll?
Woodings.
Yes.
Agent.
Yes.
Clegg.
Yes.
Halliburton.
Yes.
Sanchez.
Yes.
Thompson.
Yes.
All in favor, motion carries.
Thanks. And now, let's see, we have under ordinances, Item 5C, third reading.
Thank you, Madam Mayor. I move that further reading of ordinance 1320 be dispensed with and that the record reflect that it has been read for the third time in full.
We have a motion. May I have a second?
Oh, I thought I did. Sorry. Second.
We're all muting ourselves tonight. We have a motion, second. Clerk, will you please call the roll?
Woodings,
Yes.
Agent,
Yes.
Clegg,
Yes,
Halliburton,
Yes.
Sanchez,
Yes.
Thompson.
Yes.
All in favor, motion carries. ORD-13-20. An ordinance CAR 15-00029, Corey Barton Homes Incorporated, enacting Title 11, Chapter 13, Section 3 of the Boise City Code to codify the Syringa Valley Specific Plan District SP-03, provisions previously approved by Boise City Council. Adopting the Syringa Valley Specific Plan approved as part of CAR 15-00029. Amending Title 11, Chapter 5, Table 11-05.1 to add reference to Syringa Valley Specific Plan District, approving an ordinance summary and establishing an effective date.
Thank you.
Madam Mayor, I
Yes.
move that ordinance 1320 be approved.
Second.
The motion, second. Clerk, will you please call the roll?
Woodings,
Yes.
Bajent,
Yes.
Clegg,
Yes,
Halliburton,
Yes.
Sanchez,
Yes.
Thompson.
Yes.
All in favor, motion carries.
Thank you. All right. If there's nothing else to come before the council, we'll take a
thank
motion.
you. Madam Mayor, before I move that we adjourn, I just want to thank the staff. These updates are, I think, really informative, not just for council members, but I hope for community members as well. Good job, everyone. I really appreciate it.
Madam Mayor, before we
Oh,
adjourn,
sorry. I was like talking in my head. I'm not muted, and instead I'm like talking in my head. Yeah, go ahead.
that's okay. I would also like to note that tonight marks the last city council meeting for our interim police chief, Mike Masterson, and thank him for stepping in a time when we really needed him, and thank him for his repeated service to the city of Boise.
Council President,
Here,
Kirk,
here.
I am so glad you mentioned that. I am so sorry that I didn't even put that together. So I'd just like to say, to echo that thanks as well. It has been just a dear, deep pleasure of mine to work with the acting Chief Masterson the last couple months, and truly will miss him. Know that we're in good hands moving forward, but thank you, Chief Masterson, for coming back when we needed you, for staying as long as you could, and for being a partner these last couple months. Truly appreciate it.
Thanks a lot. Appreciate it too.
Yeah, thank you, Chief.
Enjoy those grandbabies.
Thank you, Chief.
Good job, Chief. Well, with that, Madam Mayor, I move that we adjourn.
Second.
Your motion and second, all in favor?
Aye.
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 We are adjourned. Thanks, everybody.
Thank you.
Bye.
Bye.